So guys, I'll be talking about how informatics is transforming healthcare now. So one way for us to see the impact of informatics is that we are looking into savings. Yes, initially, di ba, on the first part of the discussion, I have been telling you that one of the challenges kasi in the implementation of technology is that it's high cost. Di ba? High cost siya, mahal siya. Mahal magpa-implement ng system, mahal bumili ng bagong equipment. But you know what? It actually leads to dramatic savings. Paano siya nagka-dramatic savings? Class, take note that the high cost is actually at the start. Okay? The high cost class is actually on the initial aspect of the project. And then later on, people will come to realize na ay okay, na minimize yung expense namin when it comes to paper. And then when you are using technology class, what do you think happens to the time spent with your patient? Kung tama yung pagkakagamit mo ng technology, what do you think will happen to the time that you're spending with your patient? Will it increase nga ba or decrease?
Decrease.
Decrease, sir.
Decrease, sir.
Decrease.
Okay. So, class, no? Okay, take note ha. I had mentioned there if you're using the technology correctly. No? So, class, the notion that we usually have is that when we use technology, isang impact daw ng technology is that nagdi-decrease yung time spent with the patient. Diba? That's what I mentioned in the earlier discussion that kapag technology daw yung ginagamit, yung time daw ng nurse, yung time daw ng nurse is inclined on using the computer, it's inclined on using the tablet, it's inclined on using the cell phones. Kung kaya class daw the impact is that it decreases the time spent with the patient. But take note, if you are using technology effectively, okay, class, if you are using the technology effectively, kindly write it down so that you will remember it. If you are using the technology effectively, dapat class, that technology would actually allow you to have more time, to have more engagement with your patient. Okay, to have more time and more engagement with the patient. Okay? How is that possible? Plus, isa pong goal, di ba? Sabi dito, dramatic savings. So, hindi ka na dapat gumagamit ng papel. You're not using your pen and paper. Instead, plus, you will be using your respective phones. And through your respective phones, for example, you will be able to tag, boy, my patient has this problem. So, it's saving you time actually. Or, instead of going to your patient, instead of taking the blood pressure manually, instead of taking the temperature manually, the machine attached to your patient would right away be able to determine the blood pressure and then at the same time, the temperature of your patient. So kung iisipin mo, umiikli yung time mo for the nursing procedures. Di ba? The time spent for nursing procedures are actually decreased so that you will have more time and more engagement with your patient. That's supposedly the goal. Yan po yung goal natin. Pero right now, reality, if you would go to the hospital, you would see that nurses are so inclined on touching the computer. There are nurses who are inclined on touching their phones, not for work purposes, but for personal purposes. Dapat po hindi ganon. Ha? Take note of that, students. Dapat po hindi ganon. We are using our technology so that you can actually spend more time on patient care. Now, look at another advantage there or maybe another impact of informatics, shared knowledge. Now, in the past, for example, if I would want to learn, if I would want to read, di ba for example, no, tinuturuan kayo sa pharmacology. If gusto niyo pong magbigay ng gamot kay patient, one thing po na ginagawa po natin is that we look for the action of the drug, we look for the side effects of the drug, tapos we look for the adverse reactions of the drug. Diba? Yun yung ginagawa natin kay pharmacology. What's the purpose, guys? What's the purpose? Why do you need to check those? Sige nga. Yes.
Para aware kasi kung maghatag ka man bisang mga bulong bising mo patient, mabalaan mo kung ano ang mga impact, mabalaan mo sir kung ano ba lang hindi pwede sir.
Okay, very good. No? So that we will be able to know the caution that we need to do when we are administering medications to our patients. That's the reason, di ba? So tandaan nyo yan, when you are about to administer a drug, you need to check the action of the drug, you need to check the contraindications for the drug, you need to know class the effect, the side effect of the drug, along class with the adverse reactions. Now, going back to the discussion on shared knowledge, class, in the past, no, when we would want to know about this, we would usually look at references such as your memes. Now we are looking at your memes. I don't know if you're familiar with memes, but if you're going in the hospital setting, we are looking at memes. So plus your memes is a multimedia drug index. Now it looks like this one. Okay, it looks like this one. Okay? And memes class is one reference that is able to give us those things that I've mentioned: action, contraindication, and then you have your side effect, and you have your adverse reaction. Another thing is that you also have your hospital formulary. May tinatawag tayo class na hospital formulary. Okay? So in the case of government hospitals, there is a government hospital formulary. Okay? There's no such book here. I think like this one. Okay? So plus when you talk about the formulary, parang it's a listing of also the medications that are being used in the hospital. Okay, so if we want to study a drug, no, we would need to go back to these books. But right now, when you want to know about a drug, you can just actually visit the internet. Okay? If you would want to know about the drug, you could just go into the internet. And as long as your sources are valid, as long as your sources are reliable, you can actually use that for the care of the patient. Okay? What else in shared knowledge? Now, what else in shared knowledge? We can actually share knowledge between professions. So, halimbawa, ako ang doktor, no? For example, I will tag in the system, the patient has pneumonia. You as a nurse will be prompted right away that I am managing the patient for pneumonia. Okay? Plus in the hospital, it used to be like, si nurse, kung hindi ka, for example, sumasama kay Doc Mag-rounds, minsan you do not know what's happening to the patients. Now, picture yourselves that you're taking care of 6 to 8 patients in a private setting. Pag sa government setting, maybe 15 patients yung tinitake care mo. Now, picture yourself having the 8 patients, tapos si doc nag-ground sa isang patient mo. Pagkatapos, si doctor nag-grounds doon kay patient, nag-explain kay patient, habang ikaw busy ka kay second patient. Okay? Wala ka ng update. That's what is happening to the first patient. But the technology allows us to share knowledge. Okay? Now, patient participation. Plus, with patient participation, your patient also get updates. Your patient can also access relevant information. Okay, your patient receives update and they can also access relevant information. Now, give me an example, class. If you are a nurse, how can you make your patient participate? If you are a nurse, how can you make your patient participate in the care? Sige nga.
Educate them, sir.
Educate, no? Educate. That's a very big word, no? A very nice word for us to do to our patients. Now, fundamentals, no? If you are asked in the fundamentals, who's the best person to plan for the care? Class, who is the best person to plan for the care of the patient? Any answer? Sige nga. Before I would go to the point, who is that person, class, who is the best person to plan for the care of your patients? Who do you think?
Nurses.
Ideas? Yes, I saw Jody. Yes, Jody?
Nurses, sir.
Nurses. If you get to choose now, if the choices would be between the nurse and the patient, who do you think is the best person to plan for the care of the patient?
Patient.
Okay, class, actually, it's the patient. No?
Elise.
Actually, it's the patient. Class, the
Patient.
nurse is only actually a guide to the patient. So your goal here is to be a mentor. It's okay, no, I understand. Common answer there is nurse. But class, the best answer, no, the best and the correct answer is that the patient. If you will be asked who will plan for discharge, it's actually the patient. Okay? What will be the role of the nurse then? The role of the nurse class is to facilitate the process, to aid the process, to educate the patient on the process. Now, going back to the point here, as our classmate earlier informed us that one way to make the patient participate is education. Okay, so what's the connection then of nursing informatics? Plus, in your nursing informatics, you are able to educate your patients using applications. Okay, you can educate your patient using applications. You can also educate your patients class using medical videos that are available online. Plus, in big hospitals actually, hindi po sila sinasabi na, uy, punta ka sa YouTube, doon ka manood ng videos. Hindi po ganon in the big hospitals. In the big hospitals, class, what do? They are the ones who make the videos that their patient can use. And that's what they do. And when you talk about applications, no, for example, no, if you are a nurse, kasi guys, take note, if you are a nurse, your main role is that to ensure that your patient will be able to have optimal functioning. Okay, your patient would have optimal functioning. So class, when I say optimal functioning, take note the term is optimal. I did not use the term normal. Okay, halimbawa kasi if you're dealing with a patient who is pilay, if you are dealing with a patient who had just amputation, meaning class, for example, the extremity is cut, you could not expect them to do it normally, right? So you expect them to do it optimally. Ibig sabihin, the maximum that they can. Now, what's the message here? If you would want your patient class to do the optimal functioning, you allow them independence as much as possible. You allow class independence as much as possible. And how do we do that? If your patient can do it, make your patient do it. Okay, again, if your patient can do it, make your patient do it. In other words pa, no, inilonggo yung sinasabi nila na wag mo siyang i-baby-baby. Okay, don't baby-baby your patient's class. You are not actually helping them, but you are making them dependent to you and they will be unable to do their thing. Okay, that's what we do as a nurse, no? So, one way for us to do that is that we educate our patients, no? For example, dear students, if I will say, for example, that a medication needs to be given TID, what do I mean by TID, guys? What do I mean by TID?
3 times a day, sir.
Okay, it means 3 times a day. Okay, give me a timing for TID. What time of the day will I be giving that? Anybody?
Every 8 hours.
Okay, 8 hours. What else? 8 a.m. Then?
816, sir.
Okay, 816. 816. I heard somebody earlier who mentioned that it is every 8 hours. Okay? I understand the confusion na. But please guys, don't be confused. Your TID is actually different from every 8 hours, which is your Q 8 hours. When you say every 8 hours, guys, that would mean 8 a.m. 8 plus 8 is 16, so that would be 4 p.m. And then that would be 12 midnight. Compared to your TID, that is 816. Okay, that is 816 for your TID. Okay, so please be careful. There are two different things. And class, by
Okay, sir.
experience, that is also one of the common, what do you call this? Medication error that is happening in the clinical setting. Okay, so please be careful about that. But anyway, going back to my point, di ba? 816. So dapat class, you should teach the patient, okay? If your patient class knows how to use technology, you can actually ask them to download applications that would remind them of their medications. Okay, so pwede ka, sir, you can go to Google Play or at a Google Play Store, or you can go to the App Store if they're using Apple. Then they can download applications that would be reminders to them as to how to administer their medications. Plus, try to search, Try to search karon. Once you have the time, try to open your Google Play Store, try to open your App Store. You will see that there are applications wherein you can schedule the medications for your patients. Plus, with that simple thing, actually already increases your patient participation. It actually already increases your patient participation, and that is where informatics is coming in. Another way, class, another way. So sabi ko kanina, web applications. Another way, class, of application of applying that is that there will be a database that is accessible to your patients. Plus, there are already hospitals wherein ang routine natin, sige, sino dito nakapagpa-extract ng dugo? Who among you here had CBC?
Kami
Okay? Tanan, lahat kayo, lahat.
Tanan,
O,
sir.
sige.
Tanan,
Kate,
sir.
sige, let's pick it from Kate. Kate, when you had your CBC extracted, how do you get your results? Sige na, how do you get your results, Kate? How many?
Sir?
Yes. If you have your CBC, if you had your blood test, how did you get your results? Sige na, how did you get your results?
Hatag na masabot, sir.
Dinatag, di ba? So
Oo,
you
sir.
went back to the hospital, you went back to the clinic where you had your
Oo,
blood
sir.
test. Tama? No? You went back. Okay? Plus right now with the technology actually, if your patient can actually access the database, I can give Kate an account that is only accessible to him or her. That account class would allow Kate actually to participate in his or her care. Okay? So, Kate will be able to see, ay, ito pala yung result ng CBC ko. Does Kate need to go back to the hospital? No. Okay? So, right there and then, class, you are encouraging your patient to be involved in their care. So, those
Sir,
are some of the trends actually.
question lang,
Yes,
sir.
yes.
Wala, sir, ang kata sa call center, wala, sir, may upod ko mga call center. Pwede nila, maka-request sila, sir, sa medical certificate through online. Ang lagi natawag nila, sir.
Yes, that's also one thing for us to encourage
Okay.
patient participation. Okay?
Thank you, sir.
So, as you can see, no, these are not things that only happen abroad, but there are actually opportunities here, especially in our locality, that are doing the same. No, marami nang gumagawa niyan dito in our case. So, if you would think about it, that actually increases patient participation. Look at you guys, no? If you're going back and forth to the hospital, di ba stress? Di ba additional expense? Whereas you also have your cell phone, you also have your access to the internet, especially right now that you're having online classes. I'm sure you have access to the internet. Diba? It actually saves time and actually encourages your patient to participate. Now, with all of those things mentioned, one problem naman that arises is the impersonalization of care. Ito kanina class yung sinasabi natin na nagdi-decrease yung time spent by the nurse, no? Na nagdi-decrease ang time spent by the nurse in taking care of their patients because plus there is impersonalization of care. Now, when we talk about impersonalization of care class, yan, impersonal. Ibig sabihin parang yung approach hindi na personal. Ibig sabihin class parang wala ng human touch. Okay? That's a concern, no? That's one of the ways that informatics is transforming care. But take note, class, when we talk about impersonalization of care, okay, that's considered to be ineffective use of technology. Ineffective use of technology yan. So dapat kayo bilang nurses, you would make technology as a tool for you to give more time to your patients. Now, increased coordination. Class, when we say increased coordination, just like earlier when I talked about shared knowledge, no? So class, there is interprofessional collaboration. There is interprofessional collaboration. Now, point for example, no, if our patient would have X-ray, plus our patients could already be able to see their X-ray images. The doctor in the clinic could see the X-ray image. Okay, and any doctor who will be coming in to care for the patient class will already be able to see class the X-ray of the patient. In the past, you know what happens? Every time the doctor would make rounds, you need to show the X-ray. Doc, here's the X-ray, here's the present X-ray, and then you need to stand by that at the bedside. No? So that's also one way for us to think that it also decreases the expenses in the hospitals. That's why despite the technological advancement, these procedures are not actually becoming very expensive because it actually reduces the cost in the hospital. Okay? Have you seen the X-ray plate na may negative? Have you seen that? The old X-ray plates in the past, where in class there is a negative. I don't know if you're still familiar of what I'm talking about. Okay, there are still X-ray clinics who are using this na. Okay, yung parang film baklas na negative, na parang nire-raise against the light so that you will be able to see it. No? Unlike right now, you can already see that in the computer. Now, also class, you would have improved outcomes. What do we mean by improved outcomes? Class, there is shorter length of stay. There is higher quality of life, and there is actually minimal expenses. Okay, so class, that's the goal of nursing informatics and informatics in general. Plus, when I say length of stay, class, shorter length of stay is usually associated with better outcomes, no? Pagkatapos, decreased readmission rates pa pala. Decreased readmission rates. Okay, going back, plus when I say shorter length of stay, ibig sabihin the patient are only staying in the hospital for 3 days. For example, instead of 1 week, no, the care class is becoming shortened because the computer is able to give us data as to how to improve the condition of the patient. Okay, so there are things that are being escalated. Now, let's talk about the term information science. Plus, when I refer to the term information science, it deals with the effective collection, storage, retrieval, and use of information. Okay? Why are we learning information science? Diba, when I talk about informatics, especially plus your nursing informatics is a combination of what are the three sciences? Sige nga, what are the three sciences combined in nursing informatics? Anybody? Sige na, when I talk about nursing informatics, what are the three sciences that are combined in nursing informatics? Yes?
Nursing science, computer science, and information science, sir.
Okay, very good. So you have your nursing science, you also have your computer science, and then you have your information science. So plus these three is the combination that we have in nursing informatics. Now, for that reason, we are having this definition of information science. And when you talk about information science, collection, storage, retrieval, and use of information. That's the very goal of your information science, to collect, store, retrieve, and use the information. And then plus it is concerned with the recordable information and knowledge and the technologies and related services that facilitate their management and use. Kumbaga, class, ang main purpose lang din naman ng information science would go back to your DIKW model. Okay, it's about class making use of information to become knowledge and later on to become wisdom. Okay, we'll discuss the IKW sooner. Plus, so information science would also include the following: cognitive science, okay, you have your computer science, social science, communication science, and even your library science. Okay, now, di ba library, when we talk about library, we would usually remember library to be something na may books, di ba? But right now, class, the trend is actually going towards electronic libraries, no? And libraries are already able to store electronic databases that could be of help, no, to our clientele. Now, look at that. Look at what information science deals with. Okay, pag-obtain ng data is part of it. Gathering of the data is part of it. So if you would look at it, your information science could also be actually used in research. Kasi di ba in research, we'll obtain data, we will gather data, we will organize the data, you will manipulate the data. Class, pag sinabi kong manipulate of data, it does not mean that you will alter or you will magic the data. Hindi po ganun ang ibig sabihin ng manipulating the data. Class, manipulating the data would entail that the data is being recoded. No? There is recoding of your data. Pagkatapos, class, you manage. After you manage, you store. And then after that, you retrieve, recapture, dispose, distribute, and broadcast information. Now, you need to be careful now. So you are seeing here the term distribution. Question, in the healthcare, can I distribute any data to anybody? Can I distribute any data to anybody?
No, sir.
Okay,
No,
that's a
sir.
very big no.
No,
Huh?
sir.
That's a very big
No,
no.
sir.
Okay, I hope that you have absorbed your lesson in ethics. What ethical principle are we valuing there?
Confidentiality.
Confidentiality.
Yes, no? Privacy, confidentiality, no? Privacy, confidentiality. And then, of course, broadcasting information. So when you broadcast information, ano, halimbawa lang ha, may insurance si patient. Let's say, class, that insurance is actually referred to as your HMO. Plus, your HMO stands for Health Management, Health Management Organizations. HMO, management organizations. So class insurances, kumbaga, they can free you. They can make your healthcare free. Okay? They have certain coverage. Now let's say for example, the personnel of HMOA went to your hospital and then they would want to open the chart. Can they open the chart, class? Can they open the chart? What do you think?
Ang chart mismo, sir, I think
Yes,
no.
the patient's chart. When I talk about the patient's chart, students, please be reminded that the patient's chart would contain doctor's order, first the face sheet, the doctor's order, the laboratories, the medications, the nurse's notes, basically everything about the stay of the patient in the hospital.
No,
Can they access it? Yes, Jewel.
no, sir.
How about others?
Depende.
I guess, sir, depende or
Depende. Parang mapapaisip ka, di ba, no? Parang mapapaisip ka. Okay? So, class, actually, no? Actually, Jewel, I understand your point. But class, actually, they can access it. They can access it. But, ito lang, class, yung reminder ko sa inyo, just make sure that you would ask for their proper identification. Okay? For example, ako, pupunta ako sa hospital, sasabihan kita, Kate, I want to see the information of patient Juan de la Cruz. Kay Kate, I'm from Insurance A. So Kate, hanapan mo ako ng ID. You can politely say, Sir, good morning. Pwede ko lang po makita ang ID. Ay, pagkatapos, pwede mong ibigay sa kanya ang chart. How about Kate, if you saw me taking pictures, pwede ba class na mag-take ako ng pictures ng chart? What do you think?
No, sir.
no, sir.
No. Generally,
No.
no. Bawal yung ganon. Okay? Bawal yung ganon. Now, I understand where Jewel was coming from earlier when she said no. Actually, class, in the real setting, the best thing that you would do is you try to refer them to your data privacy officer. Or if it's the morning shift, you refer them to your head nurse so that your head nurse will be able to address them. Once nandyan yung head nurse nyo, class, si head nurse mo yung magpapakita sa kanya ng chart para mabantayan ni head nurse that the data being collected is only related to the insurance claims. Kasi class, there are things that are not covered by the insurance. There are things, class, that will be covered by the insurance, things that will not be. And then kadalasan, class, the role of the HMO personnel is to verify whether the records are true or not. Okay? So minsan kasi, class, may mga insurance na magka-cover kapag ikaw yung nagkamali. Halimbawa, kung ikaw yung nabanggaan, okay lang, ika-cover. Pero kapag ikaw yung nangbangga, hindi ka ika-cover. Pag lasing ka by the time you had the accident, baka hindi ka i-cover ng insurance mo. Okay, there are things like that. And makikita talaga sa chart, class, kasi in the chart, your blood alcohol levels will be requested for. Okay, or for example, na document that you smell like alcohol. So it might be a ground that you will not be able to avail of your insurance. Okay? Sir, paano kung magreklamo ang patient? Class, sa kanya na yon kasi naintindihan niya dapat that he will not be covered by the insurance in case something like that would happen. Now, when we talk about clinical information systems, it is used by all members of the interprofessional healthcare team. So class, pag sinabi kong clinical information system, I actually had here a screenshot of BizBox. So class, BizBox is one of the health information system that is common in the locality. Ito po ang common na ginagamit ng mga hospitals dito in the locality. The latest version that I am aware of is BizBox 8. So class, your BizBox is an example of a clinical information systems. Class, this one, there are different modules in BizBox. May PhilHealth module, may patient care module, may materials management module. The one that you are looking into is the PhilHealth module. Pero class, if you're looking at the patient care module, yung makikita po natin dito sa gilid is that you will see pharmacy, you will also see laboratory. Okay, you will also see radiology. Okay, nursing pala. I'll go back to the nursing perspective muna before the other department. Plus makikita mo dito nurse station 1, nurse station 2, nurse station 3, nurse station 4. Or depende kung anong pangalan ng station nyo. Pagkatapos class, all the names of the patients will be listed here. Okay, all the names will be listed here. If I will click the name of this patient class, pagkatapos maikiklik lang ako dito sa gilid, add. Okay? Mag-a-add ako ng request. For example, I will add laboratory. Right away, class, laboratory will be prompted that I have a request. Okay? So, class, kung makikita ninyo, clinical information systems, pwede siyang monitoring, order entry. Ano pong ibig sabihin ng order entry? Nag-enter ka ng order mo. Okay? You entered your order for a certain medication. Or pwede siyang laboratory, pwede siya class X-ray, your radiology will be where your X-ray is. Okay, and then class your pharmacy system. So basically, everything can be requested in the computer if you are using this. Okay? So when you talk naman class about the nursing clinical information system, your nursing clinical information system is actually incorporating the principles of nursing informatics to support the work that nurses do. Okay, so ibig sabihin class, this is already inclined specific to the nursing profession. So class, what are those things that nurses do? One, documentation, nursing process activities, and resources class for managing nursing care. So class, I have not yet actually seen a hospital here who is doing their charting through the computers, but I know that hospitals are moving towards it, no? Kung sa US of A kayo or sa abroad kayo class, many hospitals are actually already doing that. So documentation class is done through the system. Okay, done through the computer, done to the tablets. Okay? Actually, class, they have what they refer to as cows. Hindi po yan baka. Okay, ang cow po nila is what you refer to as your computer on wheels. Okay, they are using their computer on wheels. Okay, kasi class, di ba daw, parang joke naman na papasok ka ng room 10, tapos babalik ka ng station para mag-type kung anong nangyari kay room 10. Balik ka naman kay room 9, tapos pupunta ka na naman ng station para mag-type about kay room 9. So class, anong nangyayari? Parang may trolley class kung nasaan yung computer, tapos the nurse could bring it around the area. Okay? Paano sir kapag next nurse naman, bagong computer naman ba? No, it's just like that you're logging in and out of the system. If it's your off-duty, log out. Every time that you will document, you log in. Okay? In other hospitals, you log in and you also scan your ID. Okay, so class, there are actually different design of your NCIS, no? Your Nursing Clinical Information System. Merong mga traditional. When you talk about traditional class, nag-incorporate sila ng standardized nursing language, such as please memorize the meanings of these acronyms. You have your North American Nursing Diagnosis Association, your Nursing Intervention Classification, and your Nursing Outcomes Classification. Huwag nyo nang habulin yung sinasabi ko. Nandyan yan sa textbook ninyo, guys. So these are considered to be traditional nursing process design. And right now, there is already a protocol or critical pathway design. Plus, it's considered to be the modern. Why the modern? Because it exhibits interdisciplinary management of information. Because it allows all healthcare providers to use class evidence-based protocols or critical pathway to document the care that they need. Allow me to show to you a critical pathway so that you will be able to have a picture of what happens in a critical pathway. Class, this is one of the goals actually in the hospital setting, no? Okay, for us to have a critical pathway or a clinical pathway also in the management of our patient. Plus, a clinical pathway is just like a guide as to how to manage our patients. Okay, bakit ayaw mong magpa-drug? Okay, plus clinical pathway is like a guide as to how to manage our patients. Let me see. Okay, look at this one, class. I'm so sorry, it's very small. You don't need to see the details naman. Pero class, for example, your patient has this disorder. Okay, if your patient has this disorder, the clinical pathway will tell you, hey, you do your history and exam. Pagkatapos, these are the laboratory tests that you need to do. If the laboratory test would show low risk, magpa-ultrasound ka. Kapag intermediate risk, magpa-CT scan ka. Pag high risk, magpa-CT scan ka. Okay? Something like that. No? So it already guides you what to do with the patient along the course of the admission of the patient. Plus, the clinical pathway or critical pathways became very useful during the time of COVID-19. Di ba kung na-notice nyo nakasabi, severe COVID, go to the ICU. Okay? Less severe COVID or mild COVID, dun ka sa bahay nyo magpagaling. Okay? So we use that also in the hospital setting. And the current guide on the NCIS, di ba sabi natin currently ginagamit na siya on the NCIS or the Nursing Clinical Information Systems. How is that possible, class? In the computer class, the nurses are already able to see that a picture like the graph that I have shown to you. Okay, so madali po nating matatrack and madali po nating malalaman. So for example, no, nakalagay sa critical pathway, after 5 days, dapat bababa na halimbawa ang WBC. or dapat maging normal na yung labs ng patient mo. If after 5 days class, the laboratory did not decrease yet, meaning there is still some problem with your patient. Okay, that's why we are able to care for our patients properly because we're able to detect if there are existing problems, right? Okay, so that's it for the chapter 1 of our discussion.